Hello, welcome back to Active London 2021. We're in the home straight now, just a couple more sessions until that's it, the conference is over. So I hope you've been taking some notes. I hope you've been using that chat function like we have been suggesting to you. I haven't seen many of you tag me into any type of physical activity, so I just had my lunch and a cup of tea, but I'm sure I'll probably be able to get something in for National Fitness Day later on today. How have you been doing? Let us know, hashtag NFD, and also don't forget to let us know using the hashtag Active London about what you've been enjoying so far. The final two sessions coming up for you today. The first one, I'm going to hand over to Rob from London Sport in a moment, but this is about using social prescribing for thriving communities. What does that mean? What does that look like? How are we able to make sure that the communities in London are targeted, and targeted specifically? What are the practical steps for making sure that we can progress with those different communities and, like I say, have a cohesive effort when it comes down to bringing London into the forefront of fitness and activity? So to kick that off, we're going to hear from Tracy Lyons from the National Academy of Social Prescribing, Tom Burton from Sport England, Nicola Gitsham from NHS England, and like I said, I will now hand you over to the wonderful Rob McLean from London Sport.
Including some guys that haven't been mentioned, so we'll look forward to hearing from everyone later. Thanks to everyone for attending. Great to see so many friends and colleagues in the audience. A warm welcome also to colleagues we haven't met yet. It's obviously been a fairly unique time over the last year or so, as the original social prescribing activity that's been taking place has been complemented by a significant systematic NHS rollout. Against the background of COVID, though, things are probably still a little different to how we all expected. And the social prescribing workforce, many colleagues have been repurposed or had been repurposed into vaccination rollout. And people's needs have obviously also been impacted by the pandemic. At the same time, though, many new people have engaged with the healthcare system, which does create opportunity. We're lucky enough to have a great lineup of speakers to help us make sense of it all, though. Collectively, they'll take us through an overview of social prescribing and the Thriving Communities programme, some strategic context, latest developments, why and how social prescribing is important within communities and the healthcare system, how it fits with the bigger picture of personalised care, with some of the implications and opportunities for physical activity and sport, alongside support and resources available. So we've got some great speakers. We'll have a Q&A later at the very end of the session, actually. But to start off with, I'm just going to hand you over to my colleague, Nicola Gitsham, who's Head of Social Prescribing at NHS England and Improvement. Nick, over to you.
Thank you, Rob, and really fantastic to be with you all today. Thank you for inviting us. So if I could have the first slide, please. So over the next 10 minutes, I'm just going to set the strategic context for social prescribing. And as Rob said, social prescribing as a result of the COVID pandemic is needed more than ever. It really helps to address some of the wider determinants of health that people experience, which we know due to widening health inequalities has been exposed during the pandemic. And I think it really helps us to transform primary care in particular. So if I could have the first slide, that would be great. I'm just waiting for that. I can't see it. Should be the one with the blue triangle. So grateful if we can get that there. So whilst the slides are going up, I'll just talk to you about social prescribing. So social prescribing is part of a much bigger change that is happening within health and care systems around the country. And it's part of a model that's called the comprehensive model of personalised care. So what we know is that medicine absolutely has a place within the NHS. We've seen that through the COVID pandemic with things like the vaccine. COVID, medicine definitely has its place. But if we really want to improve the health and well-being of the country, medicine in itself is not enough. And in some cases, there are solutions that are better than medicine. So I don't know if people are looking at the news today, but there's a new report that's out about concerns over prescription of medicine within primary care, and the importance of really understanding what matters to people and what issues they're facing, and whether there are better solutions such as social prescribing to help connect people to community and to other things in the community, such as sports, art, nature, and practical and emotional support. So we're clearly having a problem with the slides, Rob, so I'll just carry on for a minute. So we still need the triangle one, and can I just check, Rob, whether people are seeing the slides? If not, I'll just carry on talking so we don't get behind.
Thanks, Nick. Yes, can we just confirm that people are seeing the slides, please?
No, shall I carry on, Rob, just talking? So we'll be able to share the slides with you after the event if you can't see them right now. So personalised care is one of the 5 key changes for every health and care system around the country. So all these new integrated care systems that are developing across the country, the 42 systems, personalised care is something that they all need to be addressing. It looks like we've got the slides. Can I please have the blue triangle? That would be fantastic. Thank you. And the model of personalised care offers it's made up of 6 components. So it's made up of social prescribing, which we're going to be talking about today, legal rights to choice, supported self-management, which is peer support and health coaching, personalised care and support planning, and also flexibility over certain elements of NHS funding, such as personal health budgets, that help people have choice and control. But everything that's at the heart of personalised care is underpinned by really understanding what matters to the person. So if we start with what matters to you, we are more able to tailor our support to people in an appropriate way. We're also more able to understand the issues that are underlying their health and well-being, such as worries about debt or poor housing, or concerns about relationships and things like that. And we're able to use solutions, not just medical solutions, but a much more biopsychosocial approach that enables us to take that holistic view of somebody's lives and actually connect them up to other solutions that can promote health and well-being. And you and your sector have a really fabulous role to play in helping people to be more active and to look after their health and well-being through physical activity. So I'm concerned that the slides aren't working particularly well, Rob. I can't see my blue triangle, the first slide. So if we can just flip back to that, I just want to make sure people can follow what I'm saying. There we go. So there's the comprehensive model of personalised care, the 6 components. It's for every health and care system in the country, and it covers many other things that you and your sector will be doing, such as supported self-management, health coaching, peer support, all of the other things that you do as well. So just know that it's part of a big transition and transformation of the NHS. So that's the first slide. So if we can go to the next slide. I think the other thing I wanted to say is that social prescribing is here to stay. It's not something that's just a nice to have. It's well written into the policy and the direction of travel for the NHS. So if I just explain what social prescribing is for anybody who's not familiar with it. So it's a way for a health professional, such as a social prescribing link worker, to connect people to community-based support, whether that's advice, support, or community groups activities, and to connect people so that we can really help them to meet their practical, social, and emotional needs. And the link worker has a really key role to play here. So we're rolling out social prescribing link workers across all primary networks in England, so that by 2023, over 900,000 people are referred to social prescribing. And in order to do that well, so that link workers have a caseload of, say, 200 to 250 people, we're really looking at aiming for 4,500 link workers over that period. So we're really building that infrastructure across the country. And what link workers do is they have the time that often GPs don't have to really sit down and have those what matters to me conversations, and have a number of sessions with somebody to really get to the bottom of their issues and help connect them up to community-based support. They also play a really key role for the primary care network, so that's GPs and their colleagues, in bridging the gap between primary care networks and the community, so helping to know what support's available in the community, such as physical activity and other support, other agencies, and making sure those connections there. So they play really important roles. So the long-term plan has made some significant commitments to social prescribing in terms of the number of referrals and the number of link workers. The commitment is written into the PCN-DES contract, so that every personalised primary care network across the country must have a social prescribing service, and that could include social prescribing link workers or a commissioned service. And we're seeing good traction across the country with over 1,500 link workers in place now, and that number's growing quickly. And the requirements for integrated care systems and primary care networks is that it's written into the operating procedures. So everything that tells the NHS what it needs to do and what's a priority. Now, if we can move on to the next slide, please. So although social prescribing didn't come from the NHS, we know it's come from a thriving voluntary sector, and it's come from local authorities, and those partnerships are really key. It is well embedded within the NHS. So a couple of things I just wanted to say here is it's not just about link workers. What we really need to do is make sure within these new integrated care systems that there's good leadership within the ICS for social prescribing and community-based approaches, and that at that place level, the local authority level, there's strategic planning across health, care and the VCSE and other partners to understand the needs of the population, to identify what type of community connectors, link workers are there, and what type of social prescribing activities, such as physical activities, are there, and then identify the gaps for the population and how they can work together to address those, whether it's through health and care commissioning, whether it's through charitable funding, or whether it's through other sources of funding, but really working together to have that strategic planning approach. And we've managed to get that into a number of those documents, including a new suite of documents that's just come out, which is advice for the ICSs on how to work, integrated care systems, on how to work with voluntary sector partners. So if we move on to the last slide, I'm not going to spend a long time on this one, Rob. I just want people to know there is good support out there to help you work with social prescribing and to support the implementation of social prescribing. And Dan and Lianna will say more about how that translates at a local level across London. And we think London's doing a brilliant job to develop a vibrant social prescribing offer for its population. But we've got some national support there with guidance, tools, materials, collaborative platform and fortnightly bulletins and webinars. So thank you for inviting me. And I'm going to hand over to Tracy Lyons, who is the national lead for physical activity at NAS, who can talk to you more about Thriving Communities work.
Thank you very much indeed, Nick. Absolutely superb to get that NHS perspective on things. And now we're very importantly going to get a more of a voluntary sector take on things from Tracey, who leads on physical activity for the National Academy for Social Prescribing. Tracey, over to you.
Thank you, Rob. Thank you, Nick. Good afternoon, everybody. I'm Tracy Lyons. I work for the National Academy for Social Prescribing, and we look at it all through around the community and voluntary sector, and looking at how we can really support and enable the community and voluntary sector to really feel part of this, because it's so imperative, as Nick said earlier, about how we connect to those communities and how the link workers and the system really connects in, and really consider how we can take that forward. So next slide, please. Really, so what's NASP? You could kind of be wondering. Could you move on to the next slide, please? I think that's the old slide. Thank you. Really, we're part of looking at this kind of revolution in wellbeing. As Nick said earlier, it's here to stay, social prescribing, and we've got a strategic plan for the next couple of years. And we're really looking at how we can help kind of make some noise about social prescribing and think about how we can really start connecting people, and most importantly, connecting organisations, really thinking about that, how we can kind of look at finding the resources that are out there that are so imperative for social prescribing to thrive, building creative and innovative relationships across the community and voluntary sector, and how do we work with statutory organisations, etc. And then really about looking at improving the evidence in two ways around that, about gaining the evidence around, what really works for social prescribing, but also where are the gaps, where are the kind of gaps in that, and and how can we make evidence easy to understand for the community and voluntary sector, and kind of shouting out and spreading about what works, because it's been going on social prescribing for many, many years. It isn't something particularly new to the community and voluntary sector, but how we can shout out about what works, ways of working, is really, really imperative. So that's a bit about NASP and what we do. I've been in post in NASP now about 5 months, so new role, and we're really looking about how we can really support the physical activity sports sector around engaging with social prescribing, supporting that, but also how we can look at how we can embed physical activity across social prescribing systems, and thinking about those kinds of ways that we can really help and support communities. Next slide, please. Next slide, please. So we're really looking to think about how we can kind of look at the growing challenge and need for solutions. Obviously, we've been in the middle of a pandemic, and we know that for social prescribing, many of the areas that we've been focusing on now is kind of COVID recovery. It's really about looking into areas of health inequality, and we know that it's about supporting people with one or more long-term conditions. It's about those people that are isolated and lonely. There's people that need support around really what matters to them, which Nick was saying. So it's starting with that individual, but they're the types of groups that we tend to see most forming around social prescribing. But for us, it's also not just about those individuals. It's what matters to those individuals, but what matters to the communities that those individuals live within. And thinking about how we can learn really from the pandemic, of when we were in those kind of times of lockdown, where we really relied upon community voluntary sector organisations to support individuals and carry them through. And how can we help and enable the sector to really link into social prescribing and support and connect, enable people to feel really part of a community. And that's something that we're really trying to look for, and look how we can kind of enable what matters to people, what matters to communities, and how kind of that driving of innovation. So that's kind of where NASP is kind of coming from around this, really supporting the community and voluntary sector. Next slide, please. So what matters? It's not simply about signposting or referral. And I think when I've worked in the sport and exercise industry for, too many years, but I do know that exercise referral can be seen as the answer. For social prescribing, it isn't the magic bullet. It is not just simply about that. It is much, much more. It really is about how we as a sector build relationships with the other sectors. How do we build a relationship with health? How do we build a relationship with the arts? How do we build a relationship with historic England, natural environment sector? How do we enable that? And how do we bring the sectors together so we start breaking down silos? So thinking about it from a much more patient-centred point of view, and thinking what matters to that individual, and not that person having to go in lots of different places, about how we can be more holistic and consider that going forward. So we want to support the community and voluntary sector in enabling that to happen, and that's what NASP is really starting to work on, and think about how we can support and enable that, so that you feel that you're part of a social prescribing movement, and you're part of something where you're interlinking and working with other sectors. So sometimes we've looked at things in the past about what we provide, and now social prescribing is much more about how you work with people, how you listen, and how you enable and really working with the community. So sometimes it can be, I've heard people in the sector get frustrated saying, well, I've told link workers about the provision that I offer, but nobody's being referred. Well, actually, it's about working in collaboration. It's about working together, and it's about working wider than just the link worker, thinking about how we can actually upskill active citizens to actually tell people about what's going on and enable connections in communities. So it really is in my world, a piece of work around community development. Next slide, please. So there is a real need for collaboration. It's not just about providing, it's about working with and embedding. It's about, we know from link workers, it's the need for things to be very accessible, embedding, working with, enabling and supporting. And we also know that if there is provision there that people can potentially be referred to, that also people need support for that. So it is about the importance of working with other sectors around befriending services, working with kind of volunteering, etc., to support people to enable that pathway to be easy and simple. And sometimes that can be an intervention in itself. We know from some of the work in the Birmingham, a local delivery pilot, that they found that just enabling and supporting people through that system is really important. And it's kind of being much more person-centred. And I suppose it's most importantly is about what matters to them. So it's about really listening in and understanding and working in collaboration with our health colleagues and with that system and thinking how we can work together and also work with the community. Next slide, please. So thinking about that, it's how can you embed your offer in a place and not just provide? It's how can you work within that place? How can you provide within that place and work with the people in that place? So the clue's kind of in the title to social prescribing. It is about being very social and bringing like-minded people together and supporting people and thinking about how you can work to connect the dots. And that's something that we're trying to work hard on within NASP, of helping people work within other sectors and connecting those dots to really removal of those silos and think and sometimes it's about thinking differently. I think sometimes we can think in the sector about things about, well, we've got to get people into exercise and then we've got to measure obviously their change, which is obviously which Tom will be saying, Tracy, don't say that. We do want to get people more physically active. Yes, we do want to get people more physically active, but sometimes the power of sport can be just as important. So a lovely little project that I've seen is something where older people that were very isolated, that had shielded through the pandemic, have then actually in a community, the local cricket club decided to get befrienders to go and meet them at their door and walk them to watch cricket. So they walked them to watch the cricket on a Sunday morning, and the people came out and had a cup of tea and a biscuit. It didn't cost anything. It wasn't where there was needed oodles of funding. It was about a community working collaboratively together to think about using the power of sport to get people out of their doors in the summer months and bring them out after the pandemic. And it's kind of those sorts of thinking differently and thinking creatively are ways that we need to kind of really work. Thinking about how we can work with active citizens. I know the social prescribing in Frome, which is renowned now internationally for the work it's done, has done so much work about working with others in communities and just letting them know that there is a sport activity going on or there's a group going on that other people can signpost people to. So we realise that this is a different approach, and we realise that there is an offer and help required for different sectors and different organisations around that. Next slide, please. So we've now developed within NASP something called Thriving Communities, and Thriving Communities is a programme where we're looking at 4 areas essentially. And what we want to talk to people about today and launch today to see if people are really interested, because we might have got it wrong and we might need to think again, is that within Thriving Communities, we're looking at how we can offer a network approach for people from our sector to come together and explore and think and consider different ways. We're looking at potentially looking at some learning and support. Some people say, well, what is social prescribing? Or how on earth do I link in with a health system? Or actually, how can I work with the arts? What are the different things I can do? So we're looking at enabling that. We've also got some projects that are running across the country that came out of COVID recovery. And we're listening and hearing from those projects around some of the things that make it really easy and some of the things that, this is really tricky, and how we can support those community and voluntary organisations. And we've also got an ideas hub where people share kind of the good, the bad and the ugly, because we can always learn from things. Obviously, when things don't go right, sometimes that's the best learning that you can get. Next slide, please. So today, what we wanted to do was to just launch a community of practice to see if people are interested And hopefully going in the chat, there'll be a link that people can click on. And if you're interested and you're a national organisation, there'll be a community of practice around there. And if you're interested from a regional point of view, Rob, who is one of our regional coordinators that's funded by Sport England, would also be able to put onto a regional slant. And we really want to hear about work that people are doing, or people would like to do, or people may have ideas, or people may say, do you know what, I just want to understand this a little bit more, and look at ways that we can really embed and work within communities. So we're launching that today. People can fill those details in, and then after today, we'll hopefully be able to meet with you all, have much more fruitful conversations, and talk more about how we can enable and link and enable really communities to thrive. Because to be honest, social prescribing works best in a community that is thriving. And if you can really build thriving within that and have a brilliant community and voluntary sector that thrives and enables and links and has support, then hopefully social prescribing will work well. So Rob, thank you for that. That's over to me. Hopefully the link will go into the chat. If it doesn't, I'm sure Rob will be able to send it out to all the delegates that's here today. And then soon I'll be handing over to Tom. Thanks, Rob.
Thank you very much, Tracy. And yes, we will make sure that link goes in the chat. Thanks so much for providing that overview of, if you like, the voluntary sectors from a voluntary sector perspective to complement Nick's presentation from an NHS perspective. Now to focus in a bit more on the sport perspective and the way that, if you like, social prescribing features within Sport England's plans. We have my colleague Tom Burton, who's National Partnerships Lead for Health and Inactivity. Over to you, Tom.
Yeah, thanks very much, Rob, and good afternoon, everybody. And I think that the presentations so far from Nick and Tracy have really provided a brilliant platform, which segues really nicely into some of what I'm about to talk through. Now, I've got about 5 minutes, so it is going to be a little bit high level. But what I'm not going to do, as the title suggests on this slide, is talk through about the content of Uniting the Movement. I'm sure many colleagues and partners on the line today will be aware of the strategy and have seen it, be aware of its content. And if you haven't, or if you're not, then there's an opportunity, if you go onto the Sport England website, that you can find out a little bit more about what some of the ambitions are over the next 10 years, with a much more overt focus on tackling inequalities. But what I'm actually going to do is talk a little bit about, well, where does social prescribing fit into this? You know, some of these ambitions, where does it fit, and what does that look like over the coming years? So if we can go on to the next slide, please. Thank you. So, many colleagues attending today will be familiar with the 5 what would have been described as big issues in the strategy. And these are some of the really meaty topics that have come out loud and clear from 18 months, 2 years of co-design and consultation with a wide range of partners, as these are the areas that the strategy really needs to step up on. So in terms of social prescribing, I guess that it really weaves through all of these, and whilst it primarily sits within and will be situated, I guess, primarily within the connecting with health and well-being big issue, for all the reasons you've heard from Nick and Tracy already around those connections with the health and social care system, both locally and nationally, where that bridge is, and the interconnectivity with physical activity and sports sector. Of course, it clearly is linked here. But if we look at actually the recover and reinvent big issue of the strategy, it really talks to supporting people that have been disproportionately affected by the pandemic, having a real thriving network of sport and physical activity organisations and opportunities that really do meet the needs of the audiences they want to support and the communities they want to support. Being a really inclusive, accessible and supportive network of opportunities. And of course, that's going to be really important to social prescribing in terms of people's individual journeys and the opportunities that are there locally. We do want that to be an inclusive, supportive environment. It's also there in the likes of connecting communities. So this is really rooted in better understanding and making sure all the work we do is rooted in the needs and context of local communities and people's choices and people's needs, and making sure that actually it's people's lived experience that we listen to and really understand and ensure we can respond to and have an offer that really talks to that. So actually it's really important that social prescribing is very much rooted in place in terms of whether it be local context and the role that link workers might play, or broader social prescribers, what the local sport and physical activity landscape looks and feels like, and making sure that does very much respond to that local context. So I think it's really important that that whilst these are presented as 5 separate big issues, they absolutely interconnect. And I think an important part to say is, whilst we talk about inclusive and supportive environments, and that is something we are all talking about with Tracy and with Rob and other colleagues as well, we do want there to be a real breadth of opportunity, right from self-activated type activity, people feel capable and motivated to go out and be active in their own time, but should they require a much more intensive level of support with someone that perhaps better understands their needs, and that's there for them locally as well. So it's important that we have that breadth, and that's something we're really committed to supporting. Next slide, please. So again, you'll be familiar with some of these. If you're familiar with the strategy, these are the 5 catalysts for change. They're almost the underpinning building blocks for how we'll achieve some of those ambitions over the next 10 years. And without talking through, and I haven't got time to talk through all of them now, but just to pick on a couple of them, some of the effective investment models. Well, I guess a good example of that, how we've supported the social prescribing work stream specifically is, if you look at some of the work that Tracy is doing with NASP, and how we continue to work with nationally. Rob, of course, is doing some fantastic work in London, along with there's 6 other regional advisors across the country that are specifically looking at physical activity and social prescribing at a regional level, looking to connect a lot of the dots and support local organisations. That's a network of individuals that we've been able to support. But it's not just the specifics around social prescribing. Actually, if you look at the whole landscape of sport and physical activity, and almost everything we find is going to play a supportive role around social prescribing. So it's not just looking through a narrow lens, it's looking through the broadness, I guess, of all the organisations and programmes that we might support. We've also got the power of people and leadership in there, and I guess that kind of speaks for itself, but whether it's the volunteer, the frontline workforce, whether it's the link worker, whether it's some of the core system partners across sport and physical activity, and how we can really work with and collaborate with health and social care partners, absolutely is integral to this. And we know that a lot of this is around high quality data, insight and learning is going to be key. So what are we learning together? How are we sharing together? How are we getting this national to local to regional piece right? And I think that feels really important. We've all got a role to play. It's just working through, where we best fit within that ecosystem. So it really is quite a high level sort of whirlwind tour, but it's just to say we are looking to, Sport England will be publishing an implementation plan, a second implementation plan that will run from 2022 to 25. That will be published later in the year. Lots of work going on behind the scenes as to bring these big issues and catalysts to life. And we know that social prescribing is going to play a really important role in helping achieve a lot of these ambitions. So really looking forward to continuing the work with all the colleagues that I know are speaking today, and with many of you that are listening in. Last slide, I think, is just my contact details. So I will pass back over to Rob. And Rob, hopefully I did it within the 5 minutes.
You did an amazing job, like the other guys.
Thank you.
And thanks so much for that, Tom, building up the background context. And now if I could pass over to my colleagues, Dan and Lianna, who have a coordination role for NHS England for the Thriving Communities programme in London, and also are based at the Bromley by Bow Centre, which has long been a pioneer of social prescribing. So great to have these guys on with us. Dan, Lianna, over to yourselves, please.
Right.
Hi, so I'm Lianna Martin. I'm the programme manager for social prescribing at Healthy London Partnership, but I also hold a role, an NHS associate role as the London Regional Learning Coordinator for social prescribing. So that basically means my role is to support the social prescribing workforce, and we do that a number of different ways. We have a monthly newsletter that goes out to link workers. We have a monthly webinar where we get link workers together to discuss some of the challenges, thematic challenges that they're facing. We run drop-in peer supports where they can come and talk about tricky cases and offloading about some of the difficulties of doing their role. But more broadly, the role at Healthy London Partnership is thinking about the development of social prescribing across London and thinking about how we can convene multi-stakeholder groups to support the sort of sustainable growth of social prescribing, and making sure that it's really focused on what it was intended for, which is to really tackle health inequalities and be supporting some of the people with some of the challenges in managing their own health. And I work very closely with Dan. So my role used to be based at the Bromley by Bow Centre. And yeah, I'll let Dan explain who he is.
Hi, I'm Dan Hopewell. Thank you, Lianna. I'm also one of the NHS England regional associate roles in social prescribing. I'm based, as Lianna said, at the Bromley by Bow Healthy Living Centre in East London, which is one of the pioneers of social prescribing and has been developing it for about 22 years now. And I work very closely with the team, both nationally with Nick and also with NASP, but also the Healthy London Partnership team that includes a number of other colleagues who are such as Susie Griffiths and others and Dylan who are developing social prescribing in London as well. And I'm going to take us into this presentation now. If we could have the next slide, please. We're going to sort of talk a little bit, and thank you for all the preceding talks actually from Nick and Tracy and Tom, who've really set the scene for what Lianna and I are going to talk about, which is how does this all land in London? And why social prescribing is particularly important for London and particularly important in the context of both where we are in terms of the pandemic, but also, of course, today's session is particularly themed around physical activity and sport and exercise and so on. And London is this beguiling place, isn't it? It's sort of the wealthiest part of the UK, but actually has some of the largest deprived populations also within the UK as well. And that's never been more evident probably than under the effects of COVID, where London saw some of the areas of greatest incidence and greatest damage that COVID has done. And we see tremendous inequalities in London, not just in terms of the obvious ones such as income and employment levels, which vary incredibly from one place to another and from one demographic group to another, but also in terms of such things as physical activity as well. And all the studies will show that there's not just a socioeconomic gradient of health and income rather, and health in London, but also of physical activity. And you only have to be in one of London's many wonderful parks or canal walks or river walks or the wetlands of Walthamstow or something like that to really understand that actually people's use of facilities in London is very, very tiered against who they are and how they perceive themselves as well. And I think social prescribing, therefore, plays a critical role in helping to address those inequalities, as I say, some of the more obvious ones, but perhaps some of the less obvious ones as well, and therefore becomes a key part of the recovery of London. And social prescribing has been taken as one of London's sort of 4 strategic health pieces of work by the Mayor of London. And so Lianna and I work very, very closely with the GLA as well around social prescribing and its embedding within the London fabric as well. It's important to understand, and I think a number of the other presenters have also talked about this, about understanding the scale at which social prescribing works. Of course, we're in this process, as Nick talked about, of building these integrated care systems, and London has 5 of those, but they're fairly large population size of anywhere between 1.5 and 2 million people in London. Below them sit a series of integrated care partnerships, and they're forming at the moment, and there'll probably be between about 10 and 12 of those in London. And of course, below that sits the borough level, which is absolutely critical in the way, as Tracy talked about the way the third sector is funded, particularly by local authorities. And it's really important that local authorities, therefore, have access to and use social prescribing data that comes through to understand the needs of Londoners and what Londoners think they want, but also where the gaps are, therefore, in funding. But below that sit 200 primary care networks in London. And every borough, such as the borough that I work in principally, which is Tower Hamlets, Tower Hamlets has 8 primary care networks. These are groups of general practices serving populations of approximately between 30 and 50,000 patients. So these are really neighbourhood groups. And this is really one of the levels at which social prescribing plays the most critical role. Social prescribing link workers, and approximately 2 per primary care network now in London. So there's almost 400 social prescribing link workers across London. They play an absolute critical role in being the connectors, the joiners of dots, as Tracy referred to. They're often talked about as the glue within communities. They're the people who know what's going on, and they know what's going on at a very, very granular level. And that's really, really important. They're also the people who can help to encourage people to take up activities. And again, not just in terms of how they might be referred to those activities, but actually, as Tom mentioned, the support that they might need to access those activities as well. And I think there's a huge opportunity. We did a piece of research at Bromley by Bow with about 2,000 families through the COVID period. These were families with young children, trying to understand what needs were coming through. And there was a real reawakening of a desire within those families to access green space more, to be more physically active. Of course, that was very constrained under COVID. I think we need to build on that, to build the momentum around addressing and redressing some of the imbalances of physical activity within London. If we move on to the next slide now. Lianna, would you like to talk a little bit about the geography of London in minutes?
Yeah, so one of the things that we've been looking at is Dan mentioned that a lot of the social prescribers will probably be convening at a borough level, and actually more often than not, boroughs do have a social prescribing offer, a social prescribing service that perhaps is one or two providers that are hosting all of the link workers, and the link workers will be getting together on a monthly basis to discuss activities, local organisations that they might want to refer patients on to. Sometimes they might invite speakers to come along and tell them a little bit about how they take, how it's best for them to make referrals. And we realised that we were holding a lot of information about what was happening across London, but actually lots of people are getting in contact with us to say, can you please connect me with, or do you know the person who's leading the social prescribing service in Enfield? And actually it doesn't necessarily need us in the middle. So we were trying to think of a way that we can make this publicly available. So you, as people that might want to get in touch with a social prescribing service in your local area to tell them about the activity that you're commissioning or delivering, or perhaps you're thinking about shaping a service and you want some intel around what might be useful for the kinds of people that are coming through social prescribing, so that there's a ready-made referral pathway for you, and you know the thing that you're going to commission is definitely going to have take-up. This could be a really good way to find the key contacts in your local area. So this is a map we've been working on. It's not quite ready, not quite there yet, but ultimately it will give a bit of an overview about the kinds of social prescribing services that exist within the borough. That's both the health ones that sit within the primary care networks, but hopefully also those that sit within the voluntary sector as well, where possible. And there'll be key contacts. Is there a social prescribing manager? Is there a lead link worker? What's the criteria for the social prescribing that they're doing? What kinds of people are they seeing? So hopefully this will be a really useful resource, and it will be open source, so will be publicly available on the Healthy London Partnership website once it's finished. If we could go on to the next slide, please.
And so one of the things we wanted to also say was that think about social prescribing link workers as a resource for the activity providers as well. And there are some wonderful cases where social prescribing link workers have helped to shape provision, for example, working with local authorities and leisure providers around understanding the needs of low-income households in terms of accessing gyms and swimming bars, for example, in London. Or the work that's been done around community development work and building community development programs and social prescribing together, so that the link workers are handing on to community development workers who work within neighbourhoods and can support people to access things, even ironically things that may be free and right in front of their noses, as it were. It's really interesting to look, for example, at the green gym equipment in London and who uses it and who doesn't use it. And the obvious answer is that you need more than just providing green gyms on housing estates. You also need programs that support people to think about using them, to want to use them, to come together with neighbours. And so developing community development programs and projects alongside social prescribing actually allows one to really address the inequalities. One of the challenges in all of this sort of work around, say, health and well-being and physical activity, of course, is if we're not careful, we may end up inadvertently widening inequalities, because those who are, if you like, the low-hanging fruit, the early adopters, they're the ones more easily persuadable to be more physically active. And we need to work with the communities that really are less likely to take up these opportunities in quite an intense way, in quite a local way, if we're to really kind of shift the dial in terms of the inequalities of physical activity in London. And I would really encourage us to think about this as a piece of joined up community development work in which local authorities will play an absolutely key role in terms of how they fund that sort of community development provision that sits alongside social prescribing. Lianna, can I hand back to you?
What more is there to say? Dan's absolutely said it all. I think there are some really lovely examples of where link workers are working closely with their local services to think about, to flag where there are opportunities for those local services to really support those that are at the sharp end of health inequality. Not all, I think it's probably worth saying that as social prescribing is growing, and we're really working hard to encourage primary care networks to grow their teams to at least 4 link workers sort of per local patch, not all will have the time to do the community development, and not all will have the time to meet individually. So I think Dan mentioned, invite yourself along to their meetings or find out what meetings are happening locally so that you can join the already existing conversation.
Great. We're going to hand back to you now, Rob, I think.
Thank you very much indeed, Dan and Lianna, and all our wonderful speakers today. A lot of context there actually to get our heads around. I'll just try and attempt to pull them together, some of the key things that we've been talking about with some of the work that we've been doing as London Sport and as part of the Thriving Communities programme in London. So can we move to the next slide, please? Thank you. So in terms of a brief agenda, I'll talk about briefly about my role as Regional Physical Activity Advisor, talk about Thriving Communities programme in London to date, some other key synergies and shared agendas, London Sport's work on social prescribing to date, and perhaps some opportunities for us going forward. Next slide, please. So I've been in my role as Regional Physical Activity Advisor now 3 days a week, actually, since February. It's funded by Sport England in partnership with the National Academy for Social Prescribing. And I am part of a team of 7 colleagues from around the country, which means it's a great way to share information, best practice, and not reinvent the wheel. Really, to summarise my role, it's about identifying, championing and enabling the potential of physical activity within social prescribing and social prescribing within physical activity. That's how I've kind of defined it, really. Moving on to the next slide, please. And as I say, a key focus for my role is thriving communities. And I noticed something in the Slido chat earlier, actually, about the opportunities that are created by thinking a little wider about activity, culture, art crossovers, heritage, and nature type crossovers as well. And I certainly can see that already. We've got a great team in London, led by London Plus, who are the voluntary service sort of sector's umbrella agency for London. And we have representatives from each of the National Thriving Communities partners, which are Natural England, Sport England, Money and Pension Service, Arts Council, and certainly as London Sport, we're representing the sport through Sport England. And we also have a team of, at sort of ICS level, of regional, sub-regional, if you like, personal care coordinators, personalised care leads, I should say, who work with colleagues as VCS E-sector leads as well. So that's the London team. Moving on to the next slide, please. So, as others have mentioned, social prescribing does really provide unparalleled potential to reach the people we all most want to reach. But for many understandable reasons, perhaps social prescribing can sometimes seem maybe a little bit complex or maybe even impenetrable. And we certainly feel we ought to be trying to help respond to those local needs in terms of being able to make that more real, how you can get involved. So our first work with Thriving Communities partners is to try and, as actually alluding to what Lianna mentioned, trying to understand who are the key contacts in the borough that you might contact, either if you want to understand how you might respond from a strategic level, or indeed at the level, if you like, of an operator who just wants to contribute to the local needs of an opportunity, to the local needs in that area. So that's one piece of work we're doing. We're also doing another piece of work to try and determine what each of us as Thriving Communities partners, Arts Council, Natural England, etc., what we all bring to the table, where the synergies are and where the opportunities for collaboration are, and how they can share those and make them valuable for local conversations. Another piece of work that's going on at the moment is something called the Learning Together programme, which is a sort of curated capacity building programme for VCSE organisations to help them understand and navigate the social prescribing world a little bit better. It's an application-only programme, and second tranche is in process at the moment, but sort of keep your eyes open for that should there be future tranches in the future. Moving on to the next slide, please. Thank you. There's so much shared synergies and all of this for the moment. And referring back to some of the comments of Professor Fenton yesterday, it does kind of seem like a moment in time at the moment where the profile of prevention agendas higher than ever, the role of physical activity within that is recognised, and the rollout of a healthcare infrastructure from sort of national, regional down to local level, which has a focus on sort of neighbourhoods and communities and addressing health inequalities. And sort of in many ways, I certainly see social prescribing as it being at the heart of that, symbolising it and being a vehicle for helping us to progress many of the other bits and pieces associated with recovering from COVID. So many shared synergies, as I say. We've got some great conversations going on with Public Health England at the moment, and are about to relaunch the London Physical Activity for Health Network. The Office for Health Improvement Disparities, that's also being set up, and Professor Fenton referred to that yesterday. A real focus again on prevention and physical activity within that. Georgia Gold of London Councils, she mentioned yesterday the importance of physical activity within the COVID recovery and in addressing health inequalities. And social prescribing is also at the heart of the Mayor's Health Inequalities Strategy, which is currently being refreshed. So all sorts of shared agendas here, and the opportunities to try and align those. So moving on to the next slide. So the GLA have some great resources, including a sort of London social prescribing portal for the VSC sector, for commissioners, and also for link workers. There's also a social prescribing network run by London Plus. And there's also an active travel toolkit that's recently been produced to help include active travel in referrals and consultations. Some great stuff there through the GLA. Moving on to the next slide, please. In terms of London Sport's role in social prescribing, we've been involved for quite a while. Our workforce strategy back in 2018 identified the need for a new and expanded workforce if we were to reach the people we most wanted to reach. Social prescribing was coming into the view at that time for us, at least, and we conducted a piece of research with social prescribing link workers at the time to confirm that they didn't feel as confident as they might do talking about physical activity. So we developed some training in response to that, which was rolled out nationally. And actually, in delivering the training, that sort of demonstrated to us that the importance of having access to accurate, up-to-date information about local activities to link people with. So that led to something called the Physical Activity Referral Open Data Project that we did, where we were predominantly looking at the potential of shared directories of information, and also about the elements that affect and create an effective referral process. Moving on to the next slides, please. Within that, we in consultation with it was actually 9 schemes in 7 areas of London, actually. There was consensus that there were probably around 11, what we ended up calling 11 unmet needs that were important to consider in terms of giving members of the public a smooth process from identification of their needs, if you like, all the way into meeting their needs. And so we're inviting those for consideration for those who run referral programs, and also including them in our own planning. And you can see those at our website. alongside some of the solutions that have already been developed in regard to those unmet needs. So we'd invite you to look at those. We're sharing all links in these presentations afterwards. Moving on to the next slide, please. Sort of with a nod to the integrated approach that's being advocated by the NHS long-term plan, we've also been thinking about where social prescribing might fit in relation to other referral pathways, and where the opportunities for intervention might be, and where the whole smorgasbord of different products that are available, where they could potentially be applied for best impact. Again, there's not enough time to cover that now, but I'd like to share it with you afterwards in case it's of any help to you in your wider considerations. Moving on, please. Thank you. So in terms of social prescribing going forward, just trying to tie up a lot of the things that have been discussed today. Tracy's made that offer about the Moving Matters Community of Practice Network. There are the different resources on the GLA website, some great resources too that Nick's drawn our attention to, and also that Lianna has mentioned on the Healthy London Partnership website. One of the key things we'd like to try and contribute to, both as Thriving Communities partners and as a London Sport, is in brokering some of the conversations that might help to build the agenda locally. So we're thinking about that and how best we can do it in all sorts of circles. But if you'd like to contact us while we're doing that, please feel free to do so, and we'll do our best to try and help. And certainly, perhaps thinking about social prescribing in the context of the broader healthcare network might be a very useful thing to do. Those discussions will certainly take place at the forthcoming Physical Activity for Health Network on the 27th of October at 2 p.m. We'll be sharing details about that going forward. And just as a final sort of tie-up, perhaps, it does seem like that moment in time, this rolling out of this integrated care system, primary care network system, should be and could be a great opportunity to start discussions. So let's see if we can take advantage of that. So I've probably hopefully kept to my 10 minutes. I'll shut up now though and pass over to Jeanette in case we have got any questions we can try and deal with in the final few minutes. Okay, thanks very much. Over to you, Jeanette, if that's okay.
That's more than okay, Rob. Yes, thank you so much for that amazing panel. A lot to get through, a lot to digest there. And Rob, there are quite a few questions. I don't have time for all of them, so I'm going to pick some out. And Rob, you might be able to help me direct who best to answer this particular question. It's from Bridget Flynn, and she says, I run a swim community empowering mums to improve their mental and physical health. It's called Mama Swim, based in East London. How do I offer my group up as somewhere for people to be referred to? How is that happening? Because I guess that's a process quite a few delegates might want to know about.
You're on mute, Rob.
Yeah, I just asked one of my colleagues if anyone wants to answer that. Otherwise, I'll take it, guys. Up to you. I'll take that one then. Yes, I mean, I also get contacted. Lianna referred to it quite a lot, actually. And if you'd like to contact me using the email address I shared, but certainly that's that's one of the things we want to make easier, where you do have groups who want to contribute, meet local needs, make it easier for them to do so. Nick wants to offer something there, so I'll hand over to you, Nick.
Yeah, I think the role London Sport can play is really critical here, Rob. But I think what we really want to do is how can people together map all the resources in a local area? So local authorities sometimes capture that information, but certainly that's the sort of thing we're asking healthcare, voluntary sector to come together at that place level, that local authority level, to say, what are the needs of this population? What do we have in place that people can access? And how do we make sure that the community connectors know about those things? So that might be something you want to think about in London. How do you get that strategic approach? Because certainly for health commissioners and for link workers, it can be really hard for them to constantly answer questions from many people. So I think it's how does the sector work together to make that simple for those people that play the community connector role, and also look at the commissioning of health and wellbeing activities at place level.
Thank you very much. Anyone else want to contribute to that, or should we move on to another question, Jeanette, if we've got time?
Just about running out of time there, Rob, but I can encourage people to use the Q&A chat function to put your questions in there. The London Sport team are collating some of those questions. They may be in a position to get some answers to you directly, so please do keep on using that chat function. We're coming in to the last session of the day. We've got a bit of a break just before we head to it, and it's about where the people are, I should say. Go where the people are, and it's about promoting activity in non-traditional spaces. So where do we go to be a bit creative in terms of how we're thinking about promoting our activities, organisations and things that we think will be beneficial to our Londoners. So that'll be coming up at about 2:15. I'll see you there, grab a drink, and we're in for the last session.